The opinions and views expressed on this program do not reflect those of the management or staff of Community Media of Staten Island.
Welcome to RUMC Vital Signs. In this episode, we're talking about something incredibly important: youth behavioral health. More and more families are facing challenges supporting teens and young adults who need more than traditional care. That's where RUMC's Youth ACT program comes in, a unique program that brings care directly to young people wherever they are. We'll explore how this program works, who it helps, and why it's making such a difference for families across Staten Island. Joining me is Miriam Pratt-Malillo, OMH Director of Child and Adolescent Outpatient Mental Health Services at RUMC, and Joanne Parada, Program Supervisor for the Youth ACT program. Thank you for coming on the show.
Thank you for having us.
Thank you.
So, Miriam, what exactly is the Youth ACT program?
So the Youth ACT program follows a model designed by the Office of Mental Health that really focuses on assertive community treatment intervention. So it is much more intensive than a clinic. There's a lot more involvement in outreach and engaging the families with the treatment. Mm-hmm. And it's a lot more intensive in the type of delivery that it's done with the treatment itself. Mm-hmm. So it is, as I said, a prescribed model. It involves families, it involves working with the youth directly, and the entire ecosystem that the youth and the family develops in.
Mm-hmm. And Joanne, as a program director, what makes this program different from other programs that might be out there?
We get to go out to the families, mm-hmm. so we can meet both the youth and the families where they're at.
Mm-hmm. And how do you do that?
We will schedule with families. We can see children at school. We can just meet them out in the community. We have the Youth ACT van that we can take out with us and do meetings on the van as well. Mm-hmm.
Miriam, who is the program really designed for?
It's for families who are not successful engaging with services in the clinic model. So mm-hmm. the clinic model is the typical once a week coming to an outpatient clinic and then going home, waiting for the next appointment the following week. Mm-hmm. So Youth ACT serves the families who are not successful with that type of treatment or that level of treatment. So families who struggle with a lot more intensive needs in their overall, psychiatric and also family, social, and financial needs as well. Mm-hmm. So there is a subsegment of the families that we serve who require more specialized intervention. Mm-hmm.
And talk a little bit about some of the program, I think the care, the different services that are actually offered through the Youth ACT program.
Sure. So we have individual and collateral treatment or interventions that are done with the youth themselves and mm-hmm. with the parent. We also have family sessions that we can provide to both of them together, other members of the family as well. We can provide peer support to the child, to the youth that is enrolled. We provide crisis support, medication management, psychiatric consultation, and any other interventions that are clinical in nature, but also case management to ensure that the family has all of their needs covered and are connected to all the services and any other linkages as well, to ensure that we set them up for the best scenario for success.
And Joanne, what's the age group and how does someone enroll a loved one in this program?
So we meet with youth 10 to 24. Mm-hmm, okay. They're usually referred to through CSPOA, which is a Children's Single Point of Access. Mm-hmm. So the referrals will go to them, typically made by a therapist, a doctor. Our inpatient units can do it. Mm-hmm.
Is that a city agency, state agency, the one you just mentioned, the Single Point of Access? Is that a program or how is it?
It's a state agency.
It's a subdivision of the Department of Mental Hygiene.
Okay.
Mm-hmm. And the CSPOA specialist will review the chart, they'll review the referral, they'll determine eligibility, and if it's determined that the youth is eligible for Youth ACT, then we'll receive the referral, and then we reach out and make contact with the family.
As mentioned, Youth ACT is a program designed to meet patients where they are. When we come back, we'll go inside the Youth ACT mobile vehicle, a vital resource that brings the program and its care team right to a person's front door. Stay tuned.
Hi, I'm Steve Garvey, and I'm a prostate cancer survivor. But every year, 250,000 men are diagnosed with prostate cancer, and sadly, 35,000 or more die as it spreads to bones and vital organs. I'm saved because of early detection.
That's right, Steve. And besides being the #2 cancer killer of men, prostate cancer strikes black men at double the rate of the overall male population. We cannot allow this to continue.
Come on, guys. Stay in the game. For your family's sake, for your friends' sake, and for your sake.
Please, men, go to the doctor and have a discussion about prostate cancer. Early detection leads to the best outcomes. To learn more, go to fansforthecure.org. And thank you.
One of the most unique parts of RUMC's Youth Act program is its mobile vehicle. This van is more than transportation, bringing care services directly to someone's home. It's a lifeline. Talk to us about the role of the mobile van and the role it plays out there as opposed to an office setting.
Yeah, so it increases access to families, and it really, as described by our chairman, brings the clinic on wheels to them. As Joanne mentioned, we really are able to meet the families where they're at physically and reduce that barrier that sometimes or many times prevents families from engaging with the services.
Mm-hmm. And Joy, so can talk about the care that actually happens inside the van. What services can you actually do inside the van?
So we can really provide all of our services inside the van. There is a little office set up in the back where individual sessions can happen, medication management can happen, even our youth peer services. It kind of helps provide privacy that the youth may not get in the home environment. They can come out to the van and they can open up and speak freely to the therapist without really having to worry about having anybody else listen.
So how do you determine whether or not someone is you're going to send the van to the house or come to the office? How do you make that determination, or is that solely up to the patient and their family to say we would prefer to have the van come?
It's solely up to the patient.
And this is, my understanding is this is the only van of its kind in the state, right?
Yes.
So that's got to be exciting.
It is. It is, yeah.
That's fantastic that a lot of people think of Staten Island and even RUMC as this little neighborhood hospital, yet we've got a resource that no one else in the state has. Thanks to you guys. We were talking before we went on the air that you had written the grant for this program. And how does that feel to go from seeing a grant that is basically a piece of paper and actually now you've got a ribbon cutting we've just had, you have a van, and this is actually a real thing now?
Yeah, it's a very special moment because of what we can bring to the families and continuing to have the families who trust us with their care and the care for their children to be innovative and different and identify a barrier to care and being able to address it in the way that we did. So from the program perspective and the hospital perspective, I think it's something that sets us apart and really understanding the limitations from Staten Island. And personally, I think that's one of the highest achievements of my career.
And I imagine when you talk about the age group that you're helping with the Youth Act, there are, I'll say, life kind of gets in the way, school and all these other things. So talk a little bit how the van actually gets over these hurdles and helps people get that care.
So since we have the office on wheels, basically, we can go to the schools, we can go to the homes, we can meet out in the community. If a youth has soccer practice, we can kind of pull up to soccer practice and meet with them afterwards. So it really does give us the ability to travel all over the island and meet them where they're at.
And these are young kids who are in some cases in crisis situations. So providing that ease of access to care, I mean, obviously that's a big issue here on Staten Island, but I think it's a growing issue. I think in your experiences you've seen that? Yeah,
absolutely. And Joanne can speak more to this and with her experience in mobile crisis, in the ability to be able to respond rapidly.
Youth do. Our youth ends up in crisis. Sometimes families need help de-escalating crises. Sometimes they feed off of each other, and that's how crises escalate. So it does help to have the van even to separate families so that one member of the team can take the youth into the van and another member of the team can speak to the family inside to kind of try to bring everything back down and bring the family together to be able to work through the crises without a hospital visit needed.
And I'm guessing it also creates a little different atmosphere. I mean, kids sometimes and youth the office setting, the kind of therapy set, and now you're in this kind of van, and I've been in the van, so I know it's air conditioned, it's got UV, it's got all these bells and whistles, so it looks fantastic. So it's a unique environment to give care, I think.
Yes, and it's not only innovative, but it's also very dignifying to be able to bring this type of care to families. Many families don't want providers in their home. Many families are scared of having other people come into their homes. They have been socialized to sometimes fear entities and systems. And it is important to make sure that we're providing care to them in a way that doesn't feel intrusive, it doesn't feel violating, and it doesn't take away from their dignity. Sometimes their homes are not something they're ready to share with us or that they want to share. Or don't have the space, as Joanne mentioned. They may not have the privacy. They have multiple family members living in the home, or don't have a private room, which sometimes is part of the problem in terms of the stress levels that they experience. So this allows us to provide care in a way that doesn't take away from them and also makes them feel like there's dignity when they're accessing it.
Well, congratulations on bringing this program to life, really.
Thank you.
By bringing services directly into neighborhoods, RUMC's Youth Act program is redefining what access to care really looks like. When we come back, we'll get into our Myth or Fact segment. Stay tuned.
Every day, signs warn us of danger, but often, hepatitis B won't give you a warning. Hepatitis B often doesn't cause symptoms. 1 in 12 Asian Americans is infected with hepatitis B, and most don't know it. It is not spread through air or by sharing food or utensils. If left untreated, it can lead to serious liver problems. Testing is the only way to know if you have hepatitis B. Talk to your doctor today about getting tested.
It's time for our Myth or Fact segment, where I'll ask a few questions and our guests will expose if it's a myth or a fact. So, Joanne and Miriam, I'm just going to ask you 1 or 2 sentences, then you tell me if it's a myth or a fact, and just talk a little bit about why it is either a myth or a fact. So, first one, Joanne, myth or fact, kids just grow out of behavioral or mental health issues?
Myth.
Why is that a myth?
Children have so much. You know, especially in today's society with social media and everything so heavily involved in the community. When children are experiencing a hard time, when they have bullying, you know, difficulties in school, difficulties at home, it has an impact. And they won't just grow out of that. You know, it's something that they need to be able to talk to somebody about. You know, someone that they can trust and someone that may not be a member of the family who's too personally involved.
So Miriam, myth or fact, early support can make a significant long-term difference in a child's development and well-being?
That is a fact. Along with what Joanne was saying in terms of intervention, the earlier the intervention, the better. It helps us correct patterns that can, you know, become more solidified as time goes on, more beliefs, and also whenever there's a condition that lasts for a long time, it can alter the physiology of the person and the chemistry of the brain. So we want to make sure that we intervene as quickly as possible.
Great. Joanne, myth or fact, talking about mental health will make things worse or put ideas in a child's head?
That's a myth. Children need to talk about what's going on with them. If they don't, that buildup can lead to their mental health issue becoming worse and, you know, possibly moving towards suicide, self-harm, if they don't talk to somebody.
Miriam, myth or fact, many children struggle internally, even if they appear to be doing well on the outside?
That is a fact, and it's one that surprises a lot of parents. A lot of parents experience a lot of surprise and feeling blindsided that their children are experiencing the difficulties that they are, which makes it more uncomfortable and difficult for them to navigate.
Joanne, myth or fact, children of all ages can experience anxiety, depression, and other behavioral health concerns?
That's a fact. Again, with children out in the community dealing with peer pressure and school, sometimes issues at home, that constant feeling that they have to compare to their classmates. It starts in elementary school. and it just keeps going unless it's addressed.
And Miriam, myth or fact, Youth Act not only provides direct care to the individual, but also offers support to families and caregivers.
That is a fact, yes. We work with the entire family or whoever is involved in the child's life to make sure that we help them support the child and address any other challenges that they may have.
Great. I know you touched on a couple little things here, and in our next segment we're going to go more in depth on what you're actually seeing here in Staten Island. So, but thank you for clearing those up. When we return for our final segment, we'll dive into the current state of affairs on Staten Island when it comes to youth behavioral health issues.
I am blind, but I need not see. I know this road is there for me. If I'm really free.
Your life sounds pretty great. Don't let a buzz ruin it. Buzz driving is drunk driving.
We've talked about how Youth Act meets young people where they are, but what's driving the need for programs like this in the first place? What are families here on Staten Island really facing? So Miriam, can you talk a little about what you are actually seeing here in Staten Island today?
Yeah, so we are seeing an increase in a lot of behavioral disruptions in teenagers and children and young adults as well. We're seeing an increase in depression and suicidal behaviors and suicidality as well, self-injurious behavior. There's also been an increase in substance use and children actually quite young or younger than they have been.
When you say younger, what ages are we talking about?
We have seen as early as 10 years old
Really?
in Staten Island. Yes, unfortunately.
Wow.
You know, a lot of academic challenges or academic stress leading to school avoidance or truancy. And something that we have seen recently, we're seeing a lot more engagement in what some would consider criminal behavior, so a lot more fighting, gang involvement, assaults of that nature, so less pro-social behavior.
And in your experience, both, what do you think is driving this to be happening at such a younger age? Is it, I mean, have you seen more of this after the pandemic?
Yes,
Yeah.
yeah, definitely.
Okay.
We're seeing this, I think the pandemic acted as a catalyst for a lot of this issues, and the issues that we're facing are not new issues to children, they're just a lot more acute and a lot more widespread, I would say.
And are there other social factors, I'll say, that are driving some of this to happen?
Yeah, Joanne spoke earlier about social media influence and how that's impacting children, and I think that there's a lot of cyberbullying, bullying involved, just a lot of pressure that's communicated through social media, and a lot more interpersonal difficulties, I would say, that children are reporting or experiencing post the pandemic. So I would say that all those factors contribute.
And when we talk a lot now, we've said social media a dozen times just in this one episode. What advice would you have for parents when it comes to monitoring their child's social media and their activities on social media?
Definitely to monitor. Have your children's passwords. You know, sit with your children, talk to them about what's going on, make them feel safe enough that if something is going on that they can come to you.
When you talk about suicidal tendencies, we're not just talking about a child who's saying they want to harm themselves. We're talking about there's a legitimate, this child is saying they really want, right?
Yes.
We're not just talking about somebody who's saying it to get attention.
Nope. No, actual behaviors that they engage in, and it could be what we clinically call a gesture or more of an attempt. So it could be it happens in a spectrum, right? So sometimes it could be the person finds himself crossing the street without looking, or not caring if something goes wrong, or engaging in some risky behaviors, whatever they may be. And having that indifference, or not caring so much about the outcome. And then there's a more active role of actually attempting to harm themselves or end their lives. And there's a variety of means and methods that they have utilized or engaged in. There's not one in particular that I could pinpoint.
Wow. And Joe, when we talk about this, the seriousness of this, what are some of the biggest misconceptions parents still have out there about children's behavioral health?
I think a lot of parents, even providers, they look at the behaviors and they focus on the behaviors as opposed to what's underlying the behaviors. And that
So you're treating the symptoms, not the cause.
Absolutely. And that's the focus.
Yeah.
So instead of being able to have a child talk about the anxiety or the depression, they'll see a child acting out in school or talking back at home, and that's 100% the focus.
And we talked about suicide. Are we also seeing a rise in addiction in children? Substance use?
Absolutely.
Yeah, really? What
Yeah.
kind of substances are we talking about?
A variety: alcohol, marijuana.
Really?
Some experiments with harder drugs or things that are homemade. Yeah.
And is this because they're just exposed to it and have easier access to it?
Could be. I think information gets propagated a lot easier with social media as well, and with all of the different platforms that they can use to communicate with one another. I think that there's a destigmatizing that has happened with certain substances that makes them a lot more accessible and less, I guess the perception is that they're less dangerous than others. And I think that that's what makes it a lot more, I guess, less concerning for them in their perspective to engage. I would say that.
And I would guess peer pressure is a big part of this as well.
Kids want to fit in.
Yeah.
Right.
They want to belong, and a lot of their peers are doing it. We're also seeing a lot of vaping as well, and they're not sure what goes in the vape. So we're also not sure what they're using sometimes.
Right. And I've always, I've seen that in this PR vice president for public relations and marketing at the hospital. You see that in the marketing world to play to kids, and so they see vaping and they see I won't say a celebrity, but somebody, and it makes it look like it's okay, and they tend to, tend to go towards that, and it's savvy marketing, maybe for a bad reason, but you understand why it's done. Joanne, we've talked about it throughout this entire episode, but why is access to local programs like Youth Act so important for families here on Staten Island?
Because it gives children the opportunity to explore and process what's going on for them. It gives families opportunities to get their kids help, and to have access to these services is a lifeline to parents that just find that they don't know what else to do.
And as this is our final segment of the episode, I'm going to let you guys have the final word. So if someone is watching this episode, here's what Youth Act is all about, here's the programs. What message would you want to leave our viewers with?
I would want them to know that even if they're not sure what their families need, or even if they have tried to access services in the past and have not been successful, that there's other types of programs and other interventions that we can try to help and support them, and we will guide them through the process and get them to where they need to be.
Well, I think that sums it up. I think the best of luck on this new program. I think you can do a lot of work for Staten Island, but a lot of good work, and a lot of people who are in need are going to benefit from it. Thank you. Thank you for coming on the show.
Thank you.
Thank you.
So I want to thank Joanne and Miriam for sharing important information about a sensitive subject, and for letting our viewers know that the Youth Act program and Richmond University Medical Center are here to help. When we return, we wrap up this episode with some parting information on how you can partner with RUMC to make a difference in the health of our community.
You quit smoking and thought, that's that. But here's the thing about lung cancer. By the time you see the symptoms, it could be too late. But now, there's a new scan that can detect lung cancer early, when it's more curable. If you smoked, get scanned. Talk to your doctor or learn more at savedbythescan.org.
How do you know when you've made the right decision? It's the feeling you get in your gut. The one that tells you what's right or wrong. It's the one that says, sure, I can have a drink. Or the feeling that says, okay, I've been drinking. Now what? It's the voice inside you that says, I'm buzzed. Better leave the car when it's time to go. Plan ahead. Catch a sober ride. Buzz driving is drunk driving.
I'd like to thank Miriam and Joanne for joining me today. If you take anything from this episode, please know that if you and your loved one are in need of help, you're not alone. Miriam, Joanne, and their colleagues are here, ready for you to take their hand, so they can be your connection to a wide range of programs and services that truly make a difference. Once again, the intake number for the Youth ACT program and many other behavioral health services at RUMC is 718-818-6001. Richmond University Medical Center has cared for Staten Island for over 120 years. You can help ensure that that care continues by making a financial contribution to the hospital. To donate, visit our website and click on the Donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.
This program was produced through the facilities of Community Media of Staten Island.